These ADAP budget cuts are life or death. Life for the people living with this, so that we have access to our medications, and possible death if we don't.
Advocates returned to the Florida Capitol Thursday demanding protection for thousands of people living with HIV. They're pushing back against proposed changes to the state's AIDS Drugs Assistance Program that could affect more than 16,000 Floridians. I'm neighborhood reporter Lynthius Cheney at the state capitol with what has changed since the Department of Health announced the cuts in January.
HIV is not a death sentence. It's not a disgusting plague. It's something just like cancer, just like if you have high blood pressure.
In just 9 days, insurance premium assistance for more than 16,000 Floridians is set to expire. That deadline drove healthcare advocates, patients, and providers to rally across the state and at the Capitol multiple times, and again Wednesday and Thursday.
Save our healthcare! Save our healthcare!
They are still calling on state leaders to maintain full access on the AIDS Drug Assistance Program known as ADAP. Tori Samuel depends on that assistance. She says without it, she and her husband cannot afford her medication.
I work, my husband works, but we are not in a financial situation to pay $5,000 a month for some medication that I need to keep me alive.
The proposed cuts take effect March 1st in the middle of legislative session. Meanwhile, the Florida House has proposed $68 million to close the gap. The Senate has proposed $118 million. Lawmakers must now agree on a final number, and the governor must sign it before session ends March 13th. Advocate and AIDS Healthcare Foundation consultant David Poole says the current proposals are non-recurring, meaning they do not guarantee long-term stability for the program.
They are one-time funding, so we'll have to battle this out again and/or help structure the AIDS Drug Assistance Program in such a manner that it can sustain itself.
The issue was initiated on January 8th when the Florida Department of Health announced planned cuts to ADAP. On February 2nd, AIDS Healthcare Foundation filed an administrative challenge, arguing the state failed to follow required rulemaking procedures. On February 11th, the department initiated the formal rule change process. Public comment remains open through March 4th.
So we do have a gap period that needs to be addressed. We do have some hope that some of the manufacturers have indicated their patient assistance programs will assist in this. However, they do not have the capacity.
In a statement to ABC 27, the Florida Department of Health defends the changes, saying they are necessary because of rising insurance costs and limited federal funding.
Poole says for thousands of Floridians living with HIV, this is a matter of continuity and survival. The clock is ticking as lawmakers work to finalize a budget by the March 13th deadline. In downtown Tallahassee, I'm Lynthius Cheney reporting for ABC 27.